So one of the worker told me that আপনার সাথে কথা বলি আমার মন ভালো হয়ে গেল. So if I translate it, it means that I feel better already just by talking to you.
So what was your first impression when you first arrived at the dormitories?
So Sungei Tengah, it's a very large dorm. I believe there are about 25,000 dorm residents. I mean, this scale was mind-boggling, and it took me a while to overcome that apprehension, the fear. When I reflect back, this is actually a very, very unique opportunity for us to go there and try to connect with this group of people, a very, very underserved, group. So I'm fortunate in that way. I feel that it is a responsibility that we should take very, very seriously.
What does an average day at the dorm look like for you and your team?
We set up our post in the morning, and then we work continuously. We see about 150 patients per day. So it's a very intense. You get to, form that doctor-patient relationship within that very, very limited time, build up their trust. And most of the time, actually, they all need is a bit of reassurance.
What is the sentiment that the workers are feeling on the ground when you go to meet them?
They may have, roommates who are positive, so they're fearful. But deep inside, they're also very, very grateful that the doctors and the nurses are coming there on their doorstep to help. I mean, we often underestimate the power of listening, power of comfort. In these particular situations, it's actually more important than anything else. And few words of comfort will do a great job.
Do you feel like because you're able to speak Bengali, the workers are then able to open up to you more?
Yes, I think it is, because a large number of dorm residents are either from Bangladesh, so they're Bengali speaking. So it's very important that we quickly understand their problem, and it's much easier if we have a native speaking doctor or nurse, so they can connect, they can provide culturally sensitive advice.
I was wondering whether you could speak a little bit to how Ramadan is affecting the dorm operations.
It's actually made things a bit easier for me because we don't have to take lunch anymore. So it's much more flexible. The Muslim healthcare workers who are working out there, my message to them that when you feel unwell, you just stop. You take break, because that way we can come back next day rather than falling in sick and taking time off from our work.
How are you feeling about the situation in the dormitories? Are you feeling optimistic? Are you feeling worried?
I'm very optimistic that if we work together, if we send the correct message to the dorm residents, that we are there to help, do your part, and we'll do our part, and together we can overcome.